Ooh, last night, furious parents heckling the New York City Mayor Adams, demanding he unmask our kids after the mayor went back on his word to lift the mandate, which forced children ages 2 to 4 to keep their faces covered. But does the science justify keeping restrictions on toddlers? Let's ask our Fox News medical contributor, Dr. Nicole Saphier. Hey, Dr. Saphier.
Good morning, Ainsley.
Good morning. You're a doctor. Is he following the science?
Doctor and mother of 3. First of all, Ainsley, COVID-19 restrictions has demonstrated the selfishness of the adults, while complete indifference and neglect to our children. You saw Mayor Adams dancing at the Grammys and doing other things, yet still claiming that our preschoolers need to be masked. History is going to reflect very poorly on some of these measures being done, especially in terms of school closures, business closures, lockdowns, as we know that they have had severe, devastating consequences of them. Now, moving forward about masking our lowest risk populations, our toddlers, remember, the United States is the only place in the world that is recommending face masks be worn by this young population. And the bottom line is we have vaccines, we have boosters, we have high quality masks. It is time to relieve the burden of children having to protect others. In the beginning, we were saying for children to wear face masks, not necessarily to protect them because we knew that they were the least vulnerable, but it was to decrease the spread. Now we know when it comes to Omicron and its variants, especially BA2, the cloth mask being worn by preschoolers really has no effect on reducing transmission. So we need to remove these masks from children. It is not practical for them to wear KN95s or N95s as they are not made for children. It is time for us as a community to move forward. Vaccines, boosters, high quality masks for those high risk, but take off the mask from our unchildren, for our young children.
When you look at the daily average, it's 890 is the daily average of people affected, of children in this age group over the last 28 days. But recently, over the last 7 days, it's 1,254. But when you talk to these teachers, I'm sure your teachers are saying the same thing. All of our children are behind, so you have to weigh out all the factors, don't you?
Absolutely. We know that wearing face masks does impact their learning, their social development, their interactions, their speech. So it has to be a risk versus balance, or risk versus benefit. And I can tell you there's no proven benefit of these young children wearing these masks. Yes, we will see an uptick of cases. This COVID is now having a seasonal variation, just like we see with the flu. During certain times of year, we see a rise in cases. We want to make sure that people who are more vulnerable will actually start heeding the advice of the authorities when there's a rise in cases. But by continuing to mask young children, when we know that there is no proven benefit and really only harm at this point, you're going to start having more people not listen because we have such a distrust in public health authorities at this time. We have to follow the science, and masking 2 to 4-year-olds is not following the science.
Yeah, and their brains are they're learning so much at this age, and they need to be able to see their teachers' mouths, and the teachers need to see them. Thank you so much, Dr. Saphier, for coming on.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.